Okay, so let's move to the next question. So here we have a patient who is a fire victim, and he came to the ED with soot in the mouth and nose. The patient is confused, dizzy, and he is in shock. Despite receiving high flow oxygen, the patient saturation is still low. The patient lactate is 14. So what's the most likely diagnosis for this patient? Yes, this is cyanide poisoning from smoke inhalation. How would you manage this patient? So in this case, stopping exposure is very applicable. Of course, the patient is in ED, escaped the fire already, but here we have to remove the patient from exposure, and the next is ABCDE assessment and resuscitation, and then we have to give the antidote for cyanide toxicity, which is, yes, hydroxycobalamin first. If it's not available or contraindicated, the next is thiosulfate. Thiosulfate, we induce methemoglobinemia for this patient with thiosulfate. This is why we need to give later methylene blue for this patient. But the first choice, which is high yield hydroxycobalamin. Of course, we consider combined CO exposure, which is treated anyway with high flow oxygen. So a quick comparison between CO poisoning and cyanide toxicity. So both cause metabolic acidosis and both cause increased lactate, but the one response to high flow oxygen mostly is CO poisoning, which while in cyanide poisoning there is no improvement in saturation with high flow oxygen. The same gap we discussed before in, yes, methemoglobinemia. The other high yield aspect or point is the metabolic acidosis is usually profound with cyanide, and lactate is very high, more than 10 usually. At least in the questions it comes very high. So what are the toxidromes with respiratory distress and reduced saturation that doesn't improve with high flow oxygen? There is many actually, but for the exam wise, think about methemoglobinemia and cyanide poisoning. So the next case is a patient, also again rescued from fire, soot around mouth and nose. GCS is 11. Patient is tachypnic. Saturation is 75 on arrival. On starting oxygen, saturation improved to 98. So what's the most likely diagnosis of this patient? Okay, his lactate also is 5. So if you think this is CO poisoning, then this is right. As we discussed, the patient has lactic acidosis, which is not profound like cyanide. How would you manage this patient? Again, stopping exposure, ABC, and high flow oxygen, 100% oxygen through face mask. And if the CO poisoning, by the way, the case came in the last day, it was a boy in a garage. So it was not a fire. If the case is fire, we need to give empiric hydroxycobalamin for cyanide poisoning.